When you think of suicide, what comes to your mind? Well, most people think of suicide as the everyday idea of someone choosing to take their own lives with different methods such as hanging themselves, slitting their wrists, or overdosing. That would be the intentional killing of themselves for reasons that can go hand in hand with depression. Euthanasia is assisted suicide, which is still a type of suicide, but it's different because these people will have terminal illnesses or degenerative diseases as well as irreversible comas. The textbook definition of euthanasia is the painless killing of someone suffering from an incurable disease or irreversible coma, which is illegal in most places. Euthanasia should be a legalized choice that a patient should be able to make themselves, starting with something they would choose because they're in agony, because they'll be going through a prolonged pain. Today we're going to be going over the many aspects that go into euthanasia, such as the background of it, where it came from, along with the quality of life and the people dying, and then the death with dignity. I'll go over these things as well as how there are different reasons this is not already legal. What a lot of people don't know is euthanasia, how it first came about, and how this goes into the starting point. Most people haven't heard about euthanasia, or they know little to nothing about it. In the beginning, this has been thought of as a good death since they decided to come up with a name for it, and it will go with a way to stop suffering for these patients. According to the MD Michael Manning, euthanasia comes from 18th century England, and it comes from eu, which means goodly or well, and thantos, which means death. So the word's origin and the actual meaning is good death, which is why people have always thought of this as a good way of dying. In the 5th century England, there was a tolerance for euthanasia that would follow after someone would break Hippocratic oath, which would mean they could not give anyone a deadly drug, not even if the person asked for it. But after people decided to break Hippocratic oath due to the people seeing that they were going through immense pain, they had an understanding that it would be better for someone to choose a voluntary death over living and suffering in pain. The agony of these patients had a sense of the inevitability of a death in a painless sense. Everyone has different aspects in lives, and only you know how you feel, and only you know the qualities of what makes it important. The quality of life has different points and perspectives that how, if we follow it, the well-being of a person's humanity at the end will be well and have a good death along with happiness. According to Teresa A. Rummins, maintaining the quality of life at the end of life requires a multidimensional approach going into the psychological, the social, and spiritual interventions, as well as physical matters. The quality of life of a person is the standard of health, comfort, and happiness experienced over a given time. In the medical field, this has been proven of something important because that's what your goal is as a healthcare provider. In this case, Ken Bebb, he had stage 4 pancreatic cancer. He was very smart, he had a capable, sound mind, and when he found out he had cancer, it was a tragic thing to his family. As the cancer progressed and got worse, even with the great cancer treatment he was getting, he was still going through excruciating pain even on the painkillers, and even through that. He would take the painkillers more than once a day and still be in a terrible condition and have an awful quality of life. Before he died, he told his son that this is no way to live and that he wished he had a different choice. And then that's how the quality of life of him, he didn't have the happiness and the comfort that you're supposed to have. And to maintain the quality of life in someone, there are cases so where it can be extremely negative. It can be hard to have a positive quality. There's a nonprofit organization that shows support of euthanasia. The This is giving these people a choice if they can choose whether they want to live or whether they want to die, in a sense of them having control. Death with Dignity focuses on laws and acts that support euthanasia, giving the rights to have assisted dying. There are important aspects of these laws that they're already gaining support to help this become something. According to the Death with Dignity's nonprofit association, there must be 2 physicians to confirm a patient's residency, diagnosis, prognosis, and mental competence of the voluntariness of the decision. This is to make sure that a reason someone may choose to do this is voluntary, which gives the patient a sense of control and a safe sense of peace. There's a process after you put in a request that follow qualifications to where if they accept this, you will have 2 waiting periods. One after you put in your request while you're waiting for the answer, and then the other one while you're waiting for the drugs to be administered. This is under the circumstance your request is accepted. In the United States, these processes are legal in Oregon and Washington. There are a few states that have laws that do a death with dignity to support the choice of death, but in different things, which is going into passive, active, and different types of euthanasia that can go into if you're in a vegetable state or if you're just in a state of agony. This is an act that will go for nationwide approval with the voluntary suicide in the case of a patient going through this so they can have a peaceful death. Many people disapprove of this due to spiritual beliefs or circumstantial beliefs, when the main issues are the main issues why this is stopped. In many religions, euthanasia is the immoral killing of people as well as murder. Morality is a big argument between if euthanasia is right or wrong and if it should be legalized or not. But then there are other things like you shouldn't be able to choose this, while people can choose to have abortion or choose this. It would still just be a choice of a person to choose what they would want with their body. So in a way, it's kind of the same thing. And then there are different ways we already use euthanasia, but with different things, like when you put an animal to sleep. Yes, people and animals are different, but they're still living creatures. There are many reasons on why this should be made legal in different ways and aspects of this that can go into what makes this right. So when you were thinking about someone you loved and like someone's in pain, would you want them to be able to make the choice to where they can stop that themselves? Or if they want to keep living in pain, don't you think it should be their choice instead of yours? Or to help the health and mind of their family so they don't have to see them suffering and they don't have to suffer anymore. Overall, there are many reasons that we could make this a law, and it starts with making a choice for this as a family. At the end, there are many things that can go into making someone's life better for many different reasons. There are so many choices, and over this year, it has been different legal choices to make everything. This could potentially make the families and patients go through less pain by making their own decisions. If you can feel as if you have a sense of control, then they can have a needed peace throughout the whole idea of it. Today we went over many things like the background of euthanasia and how we can let people die with dignity, along with a story of someone who wishes they could have chose this that goes with your quality of life, which makes you think that yes, it's terrible. Death is a very sad, heartbreaking thing, but if you can control whether you're suffering or if you can live, would it be worth it? At the end of the day, everything's just a choice, and we should have the right to choose small things that can better our lives and go out through it overall.